Did you know that 1 in 5 adults in the United States experiences a mental illness each year? That's about 66 million people facing mental health challenges on an annual basis. Despite how common mental illness is in our society, discrimination and stigma remain present. This leaves many people to suffer in silence. For most of our human history, mental illness has been a highly stigmatized and a very misunderstood topic. For some of human history, mental health has even been criminalized. Mental health has also been institutionalized, which is a fact that not a lot of people know. Thankfully, our modern-day society and historical advances in mental health advocacy have changed how our society views mental health for the better. Two historical milestones, the founding of the National Alliance on Mental Illness, or NAMI, and the creation of Mental Health Awareness Month in May, both serve to show how far we've come in this regard. By gaining a better understanding of all of these historical milestones, one can then better appreciate the progress that we have made in the mental health world, and also learn why continued mental health support is vital for a happy and healthy America. Let's first take a look at the need for mental health advocacy by exploring the historical and current challenges people living with mental illness face. Historically, mental illness has been ignored and misunderstood. In some cases, mental illness has also even been criminalized, with people being put into jail and institutions for having mental illness. Starting in the early 20th century, people with serious mental illness, or SMI, were institutionalized with a very bleak outlook. Families had few to no resources to turn to for support. Furthermore, access to treatment for the individual was extremely limited. Public perception of mental illness was shaped by fear, a lack of information, and silence, but not correct information. Even today, stigma about mental health remains prevalent. This causes people to hide their struggles and delay their treatment. In fact, there is on average an 11-year gap between when someone is first diagnosed with a mental health condition and when they seek support. Mental health funding in the United States lags behind other areas of healthcare, and this too keeps stigma alive. Imagine a young adult struggling with severe anxiety, afraid to tell anyone about their experiences. They feel not only isolated, but ashamed and stigmatized and hopeless, not because help doesn't exist, but because they're scared to reach for it. According to the National Institute on Mental Health, or the NIMH, nearly 20% of U.S. adults experience a mental illness each year, yet less than half of them receive treatment, often because of stigma, cost, or lack of access to health care. How has mental health advocacy addressed these challenges and created solutions? Mental health advocacy is creating a positive change at the policy, systems, community, and awareness levels, both with the Mental Health Awareness Month, the founding of NAMI, and general modern-day advocacy efforts. NAMI was originally founded in 1979 when families of people with mental illness came together to advocate for public policy change, provide support, and educate communities. NAMI has helped implement laws protecting the rights of people with mental illness, including coverage under the ADA of 1990, which bans discrimination based on mental health conditions. Additionally, the creation of Mental Health Awareness Month in 1949, and this initiative expanded our public understanding of mental illness and promoted education and early treatment. Today, we no longer just have a day for Mental Health Awareness Month. We have a month to help reduce stigma and encourage people to seek help. Let's imagine the results of continued advocacy, and what could happen if we ignore these efforts. Positive outcomes if advocacy continues include a reduced stigma in schools, workplace mental health, and communities in general. There's going to be a better access to mental health resources and support. There will also be stronger mental health policies at local and federal levels. If ignored, untreated mental illness remains common. Continued societal discrimination and fear remain. There are going to be higher societal costs from hospitalizations, lost productivity in the workplace, and unemployment rates will be high. Imagine a future where every person struggling with anxiety, depression, feels supported and can access help without fear of judgment. Now imagine the opposite. Stigma persists, resources remain scarce, and people continue to suffer in silence. The choice is clear. The evolution of mental health advocacy has transformed lives, laws, and public perception, making support and awareness vital for a healthier society. Mental health has historically faced stigma, neglect, and criminalization. Advocacy initiatives like the ones above have changed public perception and access to care. You can make a difference. Support Mental Health Awareness Month, volunteer with NAMI, educate your peers, and start conversations. Now I am going to show you a timeline infographic and comparison chart to conclude this speech and reinforce key milestones and advocacy results.